Have you been abroad in the last few weeks or been in contact with anybody who's been abroad in the past few weeks?
Is this the beginning of what a coronavirus lockdown could look like in Lancashire?
This is our reception area and our waiting room. We would expect at this time of evening it would be full of patients, but today...
Pretty empty.
Exactly, yeah. Since we've moved to our telephone triage today, we're trying to keep people who don't need to be here away from the surgery.
They're taking action before an outbreak happens.
What's the name?
Doctors at this GP surgery in Blackpool are now offering just telephone appointments. From the start of this week, patients are invited in only when necessary.
At the moment, we're still seeing the patients that need to be seen, but we're just doing it in a way that we think is probably protective for patients, for staff, for ourselves. You know, we have to look at going forward. We have to try and keep primary care going as long as possible. So these are just steps that we think are worthwhile to take now. This is the room that we have nominated as our clinical isolation room.
So how long would you expect people to stay in here?
They might be here for several hours. If 111 becomes overwhelmed, as we're seeing already, then until they get through to them and get an answer. I would be most worried about the vulnerable elderly, people with underlying health conditions. And in Blackpool, we have higher than average numbers of all of those groups of people. So we're expecting to see higher than average numbers of cases.
Does that mean higher than average numbers of deaths?
You would expect so, unfortunately.
On a wet March day, the social makeup here in Blackpool and neighbouring Fylde is clear to see. Approaching a quarter of the population is above retirement age, which puts this part of Lancashire on particular alert. Up and down this coast, councils are ramping up contingency plans drawn up to prepare for other emergencies, be that flooding or a flu pandemic. Local authorities here and across the country may be hoping for the best, but they are preparing for the worst.
What would it mean for somewhere like Lancashire if you had to adopt the kind of measures that are underway in Italy?
Well, obviously that we're very significant, which is why those meetings are taking place, to plan for that being a possibility. At this stage, we don't know that it is, but to talk through how we can ensure, particularly the vulnerable members of society, aren't isolated and left compromise their health or well-being. And the fact that we've done that previously, albeit in different circumstances, gives me some reassurance and confidence that alongside residents in Lancashire, we can do the responsible thing.
Happy birthday to you, squash tomatoes and stew. Happy birthday, dear Eileen. Happy birthday to you.
At Blackpool's Pennystone Court Care Home, residents are being reminded of good hand-washing techniques.
I'll give you a squirt, don't start yet.
They may not be able to ward off coronavirus forever, but it won't be for want of trying.
Just think of the old saying, cleanliness is next to godliness.
There are nearly 40 elderly residents here, many of whom are living with dementia. Part of this is about reassuring them and their families they're being protected.
I don't worry about it, really. I just, if I'm told to do anything, I'll do it. And not to do anything, then I don't do it. But I think it's a good thing to wash your hands anyway. Yes.
I'm frightened, but I console myself that 88 years of age, you haven't got long to go anyway, so it don't matter.
It matters a lot for the people who look after Roy and everyone here. As for the staff, 1.4 million people work in social care. Providers are busy planning how to keep homes running as their employees fall ill and what procedures to follow if a resident does. For those with dementia, self-isolation just isn't an option.
The one thing that we do have to take comfort from is the fact that we deal with viruses, flu and infections all the time. So our protocols and all of our cleaning regimes remain in place because it's very, very important that we carry on doing what we do very well. We don't want anyone to be panicked about it and we want them to have trust that we're in control as much as we possibly can be.
Newsnight's learnt that one big care provider has already banned routine visits to its homes to protect staff and residents from coronavirus. MHA, which runs 90, including this one, isn't at that stage yet, but they are calling for government support for the sector to withstand the crisis.
I think the budget needs to acknowledge the coronavirus and needs to specifically make some contingency. Clearly there's going to be a real impact both for providers, and I'm thinking particularly here of smaller providers that might struggle to pay sick pay to support people through that, and to bring additional staff in to support their residents. As a national charity, we're in a position to take that kind of broader view in terms of our contingency planning. A huge number of social care providers are operating one or two or a small number of homes, and don't have those abilities to make those contingency plans themselves.
I think we'll definitely need more money if this escalates to the degree that we're expecting it to, and whether that comes from central budgets or local budgets, I don't know, but we'll need it for personal protective equipment for our staff. We'll need it for decontaminating the surgery. That may have to happen on a weekly basis, a monthly basis, and we don't have that in our budgets at the moment. Hi Lee, it's Dr. Clark at the surgery. So I've just got your result through, Lee, for the coronavirus. Have you been made aware of that from the lab?
There have been 4 confirmed cases of coronavirus in Lancashire, but this patient's not one of them.
So good news on that occasion that we were able to give a negative result. How many more of those we'll be giving, I don't know, and whether that job will fall to me in the coming weeks, I don't know. My main fear is that if 20, 30, 40% of frontline NHS workers are out of action because they either have the coronavirus or are in self-isolation, the NHS will not cope.
The NHS told Newsnight it's preparing a number of practical, robust plans to respond effectively to the pressures of coronavirus. The message from the authorities here in Lancashire is business as usual. But for how long is just another unknown.